Hey, Robert.
Hey.
One of the nurses has asked that we assist with removal of an NG tube. Now, the patient is post-op from abdominal surgery. What criteria do you think were used to determine the tube could be removed?
Well, I would think that the patient's appetite's returned and bowel sounds are present.
Right. And he also would be passing flatus, another sign that intestinal function has returned.
Right.
So let's check the order for the NG removal, gather our supplies, then we'll go see the patient.
All right, we'll do that. Hi, Mr. Needleman. How's it going?
Okay.
This is my instructor, Miss Swenson.
Hello.
She'll be observing for a little bit. Now, the doctor has said that your stomach tube can come out, and the nurse asked us to remove it. Now, I know that your doctor has explained it to you. Do you have any question?
That's good that it's coming out, because that's one step closer to going home.
That's great. Now, I'm going to go over each step with you as I go along, okay?
Okay.
All right, I know you're going to feel some discomfort for the first few seconds, but then your nose and throat will feel much better once the tube is out. Get this under your ear. All right. May I see your ID band? Can you tell me your name?
Stanley Needleman.
Okay, thank you. Just gonna raise your bed up a little bit here. Okay. And I'm going to lower your railing. There we go. All right.
Okay, we'll discontinue the suction and detach the safety pin holding the tube from the patient's gown. Now we'll take off the adhesive tape from the patient's nose.
Yeah, we'll find out if I have any blackheads, you know, like those strips.
I don't think the adhesive tape can do that. There we go.
Separate the NG tube from the suction tubing. Aspirate the gastric contents with a syringe to check replacement of the tube. And flush the NG tube with normal saline.
I could also use 30 to 50 milliliters of air to clear the NG tube.
Yes, you could. Just be sure to check the facility's policy.
Okay, Mr. Needleman. I'm gonna have you take a deep breath and hold it while I pull out the tube, okay?
Now clamp the NG tube with your fingers by doubling it on itself to pinch it off.
Okay. All right, ready? 1, 2, 3, big breath. There we go. Good job. Now I'll just put the tube in the appropriate disposable bag.
Freedom.
Good job, Robert. Now be sure to measure the NG drainage and dispose of the container and equipment according to policy. Okay, Robert, now you should continue to monitor the patient for gastric distension, nausea, or vomiting.
I'll document the removal of the tube, the patient's response to the procedure, and the amount and character of the drainage according to facility policy.
Also offer him mouth care, okay?
Okay, thanks.
All right. Thank you so much, Mr. Needleman.
My pleasure.